Hello everyone, my name is Dr. Ahmed. I'm one of the tutors here at WH Medical Courses. Now today, as part of our bite-sized section, we wanted to cover serotonin syndrome. What is it, when does it occur, and how do you manage it? So what's serotonin? Serotonin's a naturally occurring neurotransmitter. It's believed to be associated with depression. But let's quickly go back to basic principles. Serotonin is released into the synaptic cleft and then joins onto receptors onto the postsynaptic cell. And once released, excess serotonin is then reabsorbed. Now, what's serotonin syndrome? So this is essentially serotonin toxicity, which is when there's too much serotonin. So it can range from mild to life-threatening. So it's important to be aware of the symptoms. Now, what causes it? Now, this can be due to medication, so that's standard dose medication, or an overdose of medication. In particular, the medications that can cause serotonin syndrome, or SSRIs, so selective serotonin reuptake inhibitors, SNRIs, which are serotonin norepinephrine reuptake inhibitors, or MAOIs, and these are monoamine oxidase inhibitors. Also, it can also be due to medication interactions also. If other substances that can contribute, certain illicit drugs such as cocaine, amphetamines, ecstasy, opioid painkillers such as codeine can cause this condition, as well as over-the-counter medication such as St. John's wort. Now, symptoms typically occur quite soon after taking the drug, so usually within around 6 hours or so. So it's characterized by three things. So number one, autonomic hyperactivity. So that's essentially the autonomic system going into overdrive. So these symptoms can be excessive sweating, tachycardia, hypertension, dilatation of pupils, or hypothermia. Number two, neuromuscular changes. So symptoms of tremor, clonus, hyperreflexia, increased muscle tone. Number three, altered mental state. So that manifests itself as agitation, anxiety, confusion, delirium, or in severe cases, coma. So obviously, if it's severe, if patients have severe serotonin syndrome, that needs to be managed in hospital and managed according to the symptoms that the patient has. So for example, you would manage the hypothermia, you'd control the agitation. You'd have to stop the medication that's causing the syndrome. Mild cases tend to resolve within 24 hours, dependent on the half-life of the medication. But it's important to be aware of the different symptoms of this syndrome. So that's it for today. Please do remember to visit our website, whmedical.co.uk, for details of our upcoming courses. And do remember to hit the subscribe button for our regular video updates.